Welcome home to USA Global TV and Radio, a place where dreams take flight, with authentic storytelling, diverse perspectives and meaningful conversations, where global stories unite and bridges are built beyond all borders. Discover world-class education, entertainment, hope and inspiration. Together, we're building bridges worldwide. Subscribe to our channel, USA Global TV. Download our app, USA Global TV. Be our guest or join our team. Visit usaglobaltv.com. Thanks to our founder and executive producer, Dr. Jacqueline Kerbeck. Music score by Yeffy Tang from Cloud Road Music. Voiceover artist Mike Porter. Creative direction by Paul Garcia. USA Global TV and Radio, your home for global connection. All rights reserved. This video and its contents are the exclusive property of USA Global TV and Radio. Unauthorized use, duplication or redistribution in any form is strictly prohibited.
Good afternoon, everyone, and happy Monday. I am Julie Ann MEJIA, and this is episode 14 of The Holistic Alternative. Today, we have an inspiring guest joining us. She is a nurse practitioner, founder, and CEO who assists patients with a variety of health conditions through her virtual medical clinic, WFCC Medical in Niagara Falls, Ontario, Canada. She takes great pride in educating patients and medical professionals on the endocannabinoid system and how cannabinoid therapies may benefit their conditions and assist patients with obtaining their medical cannabis cards. She also helps clients navigate current product options on the market and uses cannabinoids for her own health conditions. Today, it is my great honor and privilege to welcome Bridget Watson-Favaro to the show. Bridget, thank you so much for taking time out of your busy schedule to be here today with me.
Oh, no problem. Thanks for having me.
Absolutely. So let's get right into it, my friend. It's so exciting to have you. How did you go from working in the traditional medicine sector and accepting cannabinoid therapies not only into your own life and your family's life, but helping patients with them as well?
Yeah, so it was a bit of a journey for myself. It was from my own personal journey, basically, for me to basically start to understand what cannabis was, how it worked, and for myself ending up with a medical diagnosis of MS, and then going through my own struggles with traditional pharmaceuticals, kind of going down the whole biologic agents, and then struggling with chronic pain, and then basically going for years and years with heavy narcotics, and having no relief from that. And basically every time going to my specialist and saying, this is not working, and then just getting given higher doses and higher doses of narcotics every time, going back and saying, still, it's not working. And just kind of being basically having, the head down and just being then passed another prescription saying, that's all we can really do. And, every time just feeling like I was getting worse and worse. And, being told it's just progressive disease and kind of deal with it. One day, my pain specialist that I was seeing at the time, saying, what about cannabis? What about cannabis? And for me, being told for years, cannabis was bad. It wasn't, don't do it. It was a big struggle. And medicinally, that wasn't even a thought in my head. It was just not something that, I could even kind of wrap my head around. However, being in just horrible pain, one night, my family just kind of said, like, just do it, just try it, just whatever. And at this point I could barely sit up. I could, if I was up for an hour a day, it was lucky. That was considered a good day. Cause there was days at a time, I just wasn't up. I wasn't out of bed. So, one night, just literally had some cannabis. And that was the first time in probably 8 months to a year I felt myself. I was laughing. I was, able to put thoughts together. I felt like I could understand why people would do this. But at the same time, I didn't understand why people would do this, because it didn't make sense. Like, why was this working? Because, my whole medical education, my whole understanding was that this wasn't supposed to work. This wasn't supposed to be helping me. So why did it? So then I literally threw myself into figuring out why this worked for me, because again, traditionally, I was told this was bad for me. So I had to understand why it was working for me. And, I didn't just go and start smoking it or start taking it. I had to understand it. So it was, a good year of me just educating myself before I started asking for people to actually give it to me. And then it was, going through 5 people and practitioners of asking for them to prescribe it to me. And it's basically declined for 4 other times before someone actually would give it to me. I was told I just wanted to get high all day. You just want to be stoned. And, then finally I was, with me telling them I already am on your drugs. And, was told finally when I actually was given it that, yes, I will give it to you, but was very concerned with the amounts I was already on of other narcotics, basically wanting to admit me to basically wean me off of the narcotics. And I said, I wouldn't need that. I'll be fine. I'll do it myself with the use of cannabis, because I'd already done a huge amount of research and understood that, that there was a lot that this plant could do. But then still had to do years more of, schooling and following other specialists and going to different seminars and, just learning. And it's been years of getting a lot of education on this plant to really understand it. And still, there's so much that we don't know. And so much more that we're learning about it as time goes on. And as more and more research is brought to light that we're still learning today, which has been phenomenal, because the more we learn about it, the more we can understand how our bodies can utilize it, and the more we can continue to help others, because it's been life-changing for me. I went from barely being able to be awake and be up to, being able to work full time again, and help others, as much as we can. And that's really what has been, such a blessing for me, is being able to help other people in similar situations, or, any situation that they feel that they can utilize the plant, because it can help in so many different situations. But for me, yes, I still have bad days, and I'm not going to sit here and sugarcoat it, because there definitely are. A few years ago, I was diagnosed with adult onset epilepsy, and that's still been a struggle. But I'm using a plant to help me there as well, along with traditional medicine. But it's refractory, it's difficult. But the medicine and the plant is helping me, and we're still trying to figure out there where we can tweak it with different cannabinoids. And the more we can understand it, the better it'll be. And I think we really need to understand how research can support it, and we have to get on side with making sure that the plant that we're getting is clean as well, because you can't just assume that everything on the market is good, and I think that's key as well.
Absolutely. Well, thank you for your bravery in sharing that information, because there's so many people out there, especially, myself from traditional medicine background, we're trained to tell people, hey, this is not good. This is, they demonize the plant or anything that's not a synthetic pharmaceutical. And, thank you for your bravery in sharing that story, because so many people out there are not aware, they're not given choices with the allopathic sick care model. And unfortunately, a lot of people don't do well with the traditional pharmaceuticals, and a lot of people miss out on actual relief and healing. So thank you for saying and describing this, because I think this resonates with so many people, because a lot of times it's used as a last option and a last resort when it should be used as a first.
Absolutely, absolutely. And I think, as care is changing, and it's very slow to change, but as it is, it's coming down on that model, right? Like it was when I started almost 10 years ago now, I think it was our fourth or fifth line. Now it's up to, in certain pain models, it's up to our second choice, right? So, but most of the time it's still kind of in that third line option, right? So, but again, it depends on how we can fit it in, right? So I always tell people, like, when I'm asking questions, it's always like, what have you tried? Have you at least tried? I always put like over-the-counter medications as a choice, like make that as one of your choices so that we can fit it into, one of your options, because we need to make sure that we're not making it like, you have to have chosen narcotics at least, right? Like that shouldn't be an option up there when we have such an opioid epidemic in our country, right? We can't have that as an option before we're using, cannabis, when we know that cannabis has such the risk profile, the safety profile is so much less from a narcotic option for pain management for people, right? Like when I went and I finally was given the authorization for medical cannabis, the fact that they wanted to admit me for to a rehab facility to come off of my opioids was the fact that I was on such massive doses. Like he said, basically this is enough for like 10 grown men that you're on. And he's like, I don't even understand how you are walking around. I'm like, yeah, I don't, you know what I mean? Like I literally I know I was only able to come off of those medications because of medical cannabis. Like if I didn't have that, I would still be on it either today and have even more doses, like even more massive doses, or I would literally be, dead from the amount that they were giving me, just because, there's no upper limits. There's no upper limits. That's all you're ever taught in school and by the pharmaceutical companies. There was no upper limit to your opioids because, people just keep building up tolerance, but you can only build up a tolerance to so much until your body and your respiratory systems is going to become completely suppressed. So it's a matter of like these huge risks that we just keep doing for people. And then all of a sudden our doctors get scared and we stop wanting to prescribe them because, the college is looking at us, right? So there's these huge risk factors for patients that we need to consider. And cannabis just doesn't have those same risk factors. So we just, we need to balance what's best for the patient. And, we've scared them because of this whole, craze that we did, back in, the 1930s, that we're just still, patients are still terrified of some today, that we have to re-educate over and over and over again, just to show them that cannabis is a much safer option for them than what they're already currently on. And, you see the list of medications that they're currently on when I see them today, and it's, they're on like 12, yet they're not scared of any of those, but they're terrified of, the word THC if you bring it up to them. And you're just, you're kind of still shaking your head. And yet I always go back to, like me, I was like, but it's not medicine. Why would I take this? But now it's like, yeah, that's what we were indoctrinated into, right?
Right. I couldn't agree more. I think, knowledge is power, right? We've been using these compositions for thousands of years to the point that our bodies developed a system to process them. So again, from a safety profile perspective, we've had thousands of years of testimonials from our ancestors that have used these products safely in conjunction with, our immune system. It works in conjunction with the immune system to support it. So it's a big concern, especially when we're seeing so many people either get addicted to opiates, benzodiazepines, and overdoses. So it's very scary. So I'm hopeful that this continues on an upward trend, like you stated, and that it is eventually prescribed first before a synthetic that is addictive and harmful to the body.
Absolutely. Absolutely. That's exactly what I would hope as well. It just definitely needs to move into that direction. It should be the first thought for people, right? Rather than, well, you've tried, 7, 10 other ones than this, but for sure.
So you started using cannabinoid therapies. You saw the benefit of it. When then did you decide you were going to support, with your practice, using naturalized compositions for your patients?
So I was in a like a family practice and doing walk-in type patients. And I started seeing a lot of patients coming in asking for, the refill for their opioids and getting declined. And then we started, we actually had a company come in and talk to us about cannabinoids. And I actually talked to the doctor at that point and just kind of explained, this is what I was using myself, and I just felt very strongly about it. And at that time, I couldn't, as a nurse practitioner, prescribe or authorize cannabis, but it was something that I felt strongly about educating patients on. And she was open to listening to it. And we just kind of had the conversation. And it was one of those things that she was slowly starting to look at perhaps authorizing her patients. So it was kind of a few here and there that we were really the ones that basically weren't going to continue to authorize their opioids, but we were looking at actually authorizing the patients for cannabis, basically transitioning them over. So I started educating them, she started authorizing them, and we worked with the licensed producer at the time. So it was shortly there during that time that we kind of started doing that. And then right after that, about 8 months after that, nurse practitioner started being able to authorize. So when that kind of transitioned, then I kind of moved into that whole field of, okay, well, let's learn some more. Let's take, the courses and learn what we can further about the actual, authorizations and how that works and what else. And, it was kind of digging in even further. And then I just kind of went from there, and really.
How was that process in the red tape in the Canadian government with getting not only certified as a provider to refer and even speak about some of these products and cannabinoids in general? Because I know here in the US, I have open conversation and dialogue with some of my traditional practitioners, and they're like, we can't even talk about it. So how was that process for you?
It depends. You have certain things you can talk about and certain things you can't talk about with your patients, from what cannabis is, and what it can do and what it can't do. So, it's a matter of how cannabis works and what its abilities are. But it's pretty even. Like it's there as a treatment option. It doesn't cure. It's there from as an adjunctive treatment is how we usually look at it. And we never would recommend using cannabis as opposed to traditional therapy. And again, it's usually looked at as a stepwise approach. But that's kind of how cannabis is treated in medicinal, traditional pharmaceutical therapy. And when we do get referrals, and when we talk to other practitioners who haven't used it, most of the time it's, I don't know enough about it. I don't feel comfortable. And I always tell most of the traditional medical people that's not an excuse. If I were to say I didn't know enough about anything in the regular medical background, that I don't know enough about it, I have to look further into it, right? Like if I had a patient that came with hypertension, I can't not prescribe a hypertensive medication. I have to look further into it. I can refer on, but I have to have them back to further treat their hypertension. It's really one of those things, right? Like we can't continue to use that as a crutch, right? Like we just don't know enough about it, right? We know that we have an endocannabinoid system. That's like, we know we have a respiratory system, right? It's part of our body. We need to make sure that we're starting to educate our upcoming students that are, our nursing students, our residents that are, our med students. We need to, these people that are coming in have to be educated on it. It can't just be, a footnote later to say like, oh yeah, that we also have this endocannabinoid system. It has to be part of the curriculum, and we're doing a disservice to them to not have it as part of it. We really, really are.
I couldn't agree more. And I think, from a perspective of education, I think every single medical school in the world should be required to educate about the endocannabinoid system and how cannabinoids function with the human body and work in conjunction with the immune support. It's really disheartening from a number of facets to see so many schools still not educate properly. Where do you
Yeah.
see that going in the future?
There are a few schools that have programs that are still developing programs, so it is happening, but it's slow, and even when they are coming in, there's some of them are not great when they're coming in, but when I think it will. I think it has to. Still have to continue to advocate for it, right? It can't just be something that we become just to. If we're not pushing forward enough, if we're not making those strides, and if we're not continuing to advocate for these things, then again, we're just going to become, too lax, and it'll just kind of be one of those things that falls by the wayside, right? We really need to make sure that we as patients, we as professionals that are in the industry, continue to be the voices, be the advocates for it, because otherwise our patients are going to be the ones that suffer, and we in the industry that that care about it are going to be the ones that basically suffer for it in the end, because really this is the time where we actually have some momentum, because it's out there, and we keep seeing it in the news, but then you'll see kind of this momentum, and then it kind of just waxes and wanes, right? So I think once we kind of see that wave that starts to have that nice peak, well, let's ride that wave, right? Like, let's really get it up there and keep pushing it forward, because really I think we see the benefits of it. We all know how much cannabinoids can help people, but if people don't continue to hear about it, they're not going to care about it anymore. Really, we need to keep that movement going as much as possible.
No, I totally agree with that. And, thankfully now that it's being more accepted in certain countries, we're getting more research, which is great. I'm also seeing some, anti-cannabis or anti-cannabinoid research come out too. And I kind of chuckle at it. And then, on the back end, I'm doing the digging. I'm like, all right, who funded the study? I think that's hugely important to, decipher, hey, who's paying for this research?
Yeah. Absolutely. Yeah, I do the same thing, right? Because you want to be informed, right? If there is something that is negative, if there is something that's not, good with cannabis, we need to understand it, right? Because there definitely are some interactions with cannabis, right? And some medicines don't work well with it, right? We need to be aware of that. Our patients need to be aware of that. Some conditions don't work well with it. Not everything. It's not a miracle cure, right? We're not going to fix everything with it. So we need to know that. But if you read some of these, kind of out there outlandish things that are being published, then you kind of do it like a double take, and you're like, well, what is this? What? And then you kind of, like you said, do the digging, and you're like, oh, okay, right? Definitely not appropriate. Wasn't an appropriate study. Wasn't funded properly, but or was funded by a company that really traditionally has always been against cannabis, and you're gonna get that bias already automatically right there from the top, right? So yeah, you have to kind of see that. You'll also see some that are real super pro cannabis, and you can just read it right out of from the right out of the gate, and you can see where they're funded from as well, right? So you're going to have that very pro cannabis attitude right out of the gate too. So you read that one with a grain of salt as well. So you have to read them by both standards too.
No, I couldn't agree more on that. And you know what? Being impartial about stuff, again, we have to show where the research really takes us. And there can't be an ulterior motive on the back end to research. It's not authentic. So, again, people that are looking at different research studies, please do your own research and see who's funding them, and if it actually aligns with what they're talking about. Because again, you want to give the most unbiased depiction of actual research and the facts. So buyer beware on that, and reader beware. So I couldn't agree more with that. If you feel inclined to share, you're not the only one, correct, that takes cannabinoid therapies at home?
Well, previously, my son was on cannabinoid therapies. He's not at present because has some other things happening right now. But yeah, previously he was, and lots of, I think that pediatrics is there's a huge place for cannabinoid therapy. I see in my practice, I would say a good bulk of pediatrics from, I think my youngest patient was 3 months of age to, well, my oldest patient was just turned 101, actually. So yeah, huge lifespan. But yeah, pediatrics is, I have a huge place in my heart for peds and cannabinoid therapy, because I think there's a lot of different conditions that can be seen in pediatrics, from epilepsy to autism to ADHD. I think those are conditions that are traditionally difficult to treat with traditional therapies, that a lot of families are on the fence with when it comes to traditional medicines, right? It's just one of those things that what we have traditionally is there's a lot of risk factors. There's a lot of side effects that come along with, well, what do I give my child when it comes to these medicines, right? So it's one of those things like, the side effect profile is there's cardiac risk factors to the ADHD medications. There's black box warnings. There's, a lot of things that can traditionally come along with some of these, whether it's autism medications or ADHD medications. They're almost sometimes being forced by either the school or by, the workers that are working with their children, and they're like, I don't want to do this. I don't want to have to put my child at risk for taking one of these medications. And then there's cannabis, and it's like, well, what do I do? Well, and then there's, they're kind of weighing their options, and it's like, why can't they try cannabis first? And it's what is the downside? Well, the downside is the stigma that comes along with cannabis, right? And then in some different provinces, we have the school systems, because the school systems are really fighting against some of utilizing cannabis within the school system. So sometimes you have to give it and break it through, like, well, it's first thing in the morning, and then we have to give it in the schools, right? So I've had some amazing schools, no issues. They were willing to work with us. They're fabulous. And then I have some other school systems that are just like, no, we will not give it. It's not like they just say no. Meanwhile, if you look across all the provinces, they have absolutely no right to say that. So it becomes down to a human rights issues, right? And it drives me absolutely bonkers. Like, it's one of those things where if the parents were willing to just allow me, like, I would be right there, like, fighting right there against the line. Like, the parents are like, I don't want to make waves. I don't want to do anything. Cause I'm like, no, this is like this. If this were, an epilepsy medication, if this were a blood pressure medication, if this were anything else, they wouldn't have no legal standing. They have no legal standing right now, but they're just doing it. And you don't want to make waves because you're uncomfortable at the thought of, because it's cannabis. So they're just don't want to say it. So you don't want to, I'm like, but legally they can't. So I'm like, they're just saying it because they don't want to have, a little oil sitting in a cupboard for your child because it has, CBD on it or a little bit of THC on it. Like, give me a break. But we know that this medication is helping your child. We know that this medication is helping them, not strike out at another child. Like, it's a safety issue now. And you know what I mean? But yeah, it's one of those things that we've seen it time and time again, and there's research to back it up. Like I've, and I've given them, given it all to them, saying like, here's all this research to show, like, here's some studies that have been done on kids and everything to show, like, we know that it can basically, dull down these like synapses that are happening in their brain, very similar to what kids and that happen in their brain and epilepsy, right? And yet, they just don't want to do it.
It's so disheartening because we're having the same issues over here. I had clients in the Commonwealth. I was working actually with Dr. Eric Ruby to combat some of the laws in the Commonwealth of Massachusetts. We had children that, required to take their medication at school, which weren't even psychoactive medications, right? These are non-psychoactive cannabinoids, school or a residential program, and they weren't able to be admitted to the residential program and they needed to be in there, or they couldn't take it at school because the nurse refused to give it. And it's just, I think from an ethical and a medical standpoint, I think it's totally disheartening because, again, if a prescriber prescribes anything, they're required by law to administer it. So it's really a scary thing. I'm so incredibly grateful that you are fighting for pediatrics. We're fighting hard here in the United States, and I'm hopeful that someday across the board on a global scale that these are accepted for everyone in all settings. So thank you for that. I appreciate everything. And then I have another question for you. So what type of patients, what kind of conditions do you work with at your clinic? It's a virtual clinic, correct?
Yeah. So, we see patients kind of across the lifespan, as I said, and then it ranges from I usually get you can self-refer or I get referrals, and it can range. Often it's pretty complex issues, so from complex chronic pain syndromes to sleep-related issues to mental health issues, and then it can vary, right? So and then it can go to autoimmune related health issues as well. So and then if it's even been sometimes people that have just had different a multitude of comorbidities that they just can't really pinpoint what's exactly happening, but they've just kind of had all these health related issues that they feel kind of just depleted their health over the years, and they just really feel generally fatigued, and they're not sleeping great, and they just don't feel 100%, and they just are wondering if cannabis may help them. But most of the time it's like kind of the complex chronic care related issues, pain related syndromes. So from like fibromyalgia to MS, to rheumatoid arthritis or osteoarthritis. Those are kind of the main ones. And then there's, from like, mast cell syndrome to, RSDs to, you name it, we've seen it. And then there's like the cancers, where we're treating like kind of the cancer related symptoms all the way to, epilepsies and autism and all, ADHDs and further and more.
No, that's wonderful. I'm so glad that you work with a variety of different conditions and patients. And what people don't typically understand that aren't aware of cannabinoid therapies, they help with a multitude of things. Our bodies need them, require them. And sometimes when we're off balance, right, and we're not getting exposed to cannabinoids or terpenes that our body requires, then the body goes awry. And unfortunately, we develop a lot of health issues because of a lack of stimulation to the endocannabinoid system. So I think that's why we see so many broad spectrum of disease respond well to cannabinoids.
Yeah, absolutely. I always tell people one of the first things if you're coming in and you have like sleep related issues, we want to treat, the sleep related issue first. And that's, if you're not sleeping, your body's out of whack, right? So, and if there's a hormone related issue, we need to make sure that we're dealing with the hormones first, right? And oftentimes that's sleep related as well, right? Your circadian rhythms is out of whack, then everything's going to be out of whack, right? Because your whole hormone system's out of whack. So we need to make sure that all of those are dealt with first and foremost, because realistically, nothing's going to function properly if all of those are out of line. And most of the time it's, your endocannabinoid system is part of your hormone system. So we need to make sure that they understand that first and foremost, because a lot of people don't understand that, right? Like this is part of, it's hormonal balance, and your ECS is part of that, right? Like it needs to be in line. So when we talk about an ECS deficiency, that's part of why a lot of things start to happen, right? So it's really key to make sure that everything is running part of that whole homeostasis, hormonal balance. All of this is part of how we make sure that all of these are key, right? So people talk about I have hypothyroid disease. They're always there and getting their blood work tested, right?
Right.
That's great. And eventually, hopefully we can have a really good blood test that can test our ECS, because I think that's going to be something that's really key to looking at. But right now we're not there. It's a matter of, figuring out the best endocannabinoids for you that we think about when we look at, and we start hearing people's stories and stuff like that. And we're starting to really kind of dial into those a little bit better, but it's still just kind of a guessing game and just listening to know which cannabinoids work really well for, anxiety and mood and all these kind of things. It's just a matter of kind of trying to fit those in right now, but it's still, we're just guessing right now, really. It's just about trial and error and, looking at the cannabinoids that we know that are, work with our, neuroplasticity and our neurogenesis and all of those different things. And we know that affect, different types of our systems, but we're just still kind of hoping that those are going to work and, knowing based on what they do for our systems right now. But hopefully, down the road, and I'm hoping sooner rather than later, we're going to have some blood work that we're going to be able to do that really is going to be specific for each person's endocannabinoid system. And we'll be able to say this is going to help and it's going to balance you. And these are going to be the perfect ones for you. Because that'll be really nice to be able to do for people. And,
Absolutely.
We'll be able to, give them the exact levels rather than just say start low and go slow and try this one. Right. But I think even now with the more that are on the market, the more that we have options for, which is nice, but again, it's a matter of choosing the right ones, the ones that are the cleanest, which is still the, why I tell people, don't just go to, anywhere, because really you need to make sure that you're using clean products.
Absolutely. Well, Bridget, we're getting down to the last few minutes. How can Canadians contact you if they're interested in learning more about cannabinoids or your practice? How can they reach you and your clinic?
So they can find me at my website, or they can email me, either or. And my website is WFCCmedical.ca. And then my email is Bridget@WFCCmedical.ca. And yeah, I'm happy to answer any emails or meet with any patients if they have any questions, or if they want to have a consult on medical cannabis.
Thank you so much for taking time out of your busy schedule to be with me today and for this beautiful conversation. Such an honor and a privilege. You have a beautiful rest of the day. And I just want to say thank you guys so much for tuning in. We're going to be having another beautiful guest next month. And we hope you all have a beautiful rest of the week and take care of yourself and each other. Have a great day. Take care.
Thank you.
In a world craving connection, one platform dared to dream bigger. USA Global TV and Radio, a beacon for global voices, authentic storytelling, and elevated listening. Led by visionary Dr. Jacqueline Kerbeck, the journey from a spark to a global force is now captured in one inspiring book. Honored with YouTube's Silver Creator Award for surpassing 100,000 subscribers, discover the evolution, the challenges, the triumphs, and the unstoppable spirit that created a global movement. Executive producer Dr. Jacqueline Kerbeck. Music score by Yeffy Tang. Creative director Paul Garcia. This video and its contents are the exclusive property of USA Global TV and Radio. Unauthorized use, duplication, or redistribution in any form is strictly prohibited. Now an Amazon #1 new release in paperback and ebook. Broadcasting Brilliance, the evolution of USA Global TV and Radio, is inspiring readers around the world. Join the movement that's redefining global media one story at a time.
Thank you, viewers and listeners of USA Global TV and Radio, for joining us today. We're honored to have your time and attention as part of our global community. At USA Global TV and Radio, we believe in the power of authentic conversations, meaningful connections, and creating a world of possibilities together. Want to be part of something bigger? Join our team of elevated listeners at usaglobaltv.com, a space where your voice matters and your ability to listen transforms relationships. Stay connected with us across all our platforms for thought-provoking discussions, expert insights, and empowering stories. Subscribe to our channels at youtube.com/c/USAGlobalTV. Follow us on social media and explore the endless opportunities we're creating for growth, learning, and inspiration. Together, we're not just broadcasting, we're building bridges and changing lives one conversation at a time. For inquiries, contact us at info@usaglobaltv.com. Music by Johnny Dyes. Produced by Executive Producer and Director Dr. Jacqueline Kerbeck. Voiceover by Mike Porter. Creative Direction by Paul Garcia. All rights reserved. Copyright 2025. Visit usaglobaltv.com to view our full terms and conditions.